Okay. Hi, John. How are you?
Good. How are you?
Good. My name's Lydia. I'm going to be your nurse practitioner.
Nice to meet you.
So what brings you in today?
Just a routine checkup. My wife wanted me to come in.
Oh, yeah?
Yes.
All right. Well, I'm just going to start off with some questions to just get a little bit of a better idea of your health history, okay?
Okay.
Are you currently taking any medications?
I am not.
No vitamins or herbal supplements?
I try to take my vitamin C every once in a while.
Do you know the dose?
I don't.
No? Okay.
Usually just one vitamin gummy a day.
Okay. Do you have any allergies?
I do not.
Okay. Have you ever been a tobacco smoker?
No. Just an occasional cigar when I golf.
Okay. And do you drink alcohol?
I do.
And how much?
Several nights a week, a glass of wine here and there, and then a couple beers on the weekend.
Okay. Any history or present use of illicit drugs?
No.
Okay. Do you know if you're up to date on your child vaccines?
I am.
Okay. And have you gotten your tetanus shot recently?
I have.
Hepatitis B, are you up to date?
I believe so.
Okay. Do you know if you've ever been diagnosed with a chronic illness?
I have not.
Alrighty. And have you ever had any major surgeries or hospitalizations?
The only surgery I've ever had, my tonsils removed back in 2007, I want to say. I mean, don't hold me to the date.
Okay. Do you know if you had any complications from that?
No, it went pretty smooth.
Okay. Do you have any significant family history of disease, cancer?
Yeah, my mom passed away from breast cancer. Cancer runs in her family, and then my dad has alcoholism. If you consider that a disease.
Yeah.
And his side of the family, my dad's not an alcoholic.
Okay. Well, that is certainly a disease. Are you depressed or have you ever dealt with depression?
No.
Any thoughts of suicide or hurting yourself?
No.
Okay. And are you married?
I am.
Good.
She's wonderful.
Yeah? She treats you well?
She does.
You have a nice support system around you?
I do.
Very good. What do you do?
I'm a manager for truckers. I work for JB Hunt.
Oh, that's interesting.
Yes.
Do you have any free time to do anything?
When
Hobbies or anything?
No hobbies, really. I mean, I just like hanging out with my family.
Do you exercise?
No.
No? Do you eat pretty healthy, would you say? Or?
No, my diet is probably not the best. My wife gets on me for that just because I splurge at night and don't eat during the day.
Well, you should probably listen to her. She might be onto something.
She may be.
Do you wear seatbelt and things like
I do.
that when you drive? Okay, and you have working smoke detectors, carbon monoxide detectors in your house?
We do.
And do you have a firearm?
Yes.
Oh, you do? How do you store it?
A fire alarm?
Firearm.
Oh, I don't have a
Like a
firearm.
gun.
Excuse me. I thought you said
no.
fire alarm. No, I don't
I'm
have.
sorry.
I don't have a firearm.
Okay. Have you noticed any recent weight gain or loss?
No, I mean nothing
Any weakness?
abnormal. It's the winter time, so
Yeah.
just a couple extra pounds here or there.
Any weakness or fatigue?
No.
No. Any fevers?
Mm-mm.
How about your skin? Have you noticed any rashes, lumps, lesions?
No, I typically have dry skin around this time of the year, so
Yeah.
I think that's just a normal reoccurrence for me.
Yeah, and no like severe itching or
No.
anything. Any changes in your hair pattern, brittle nails?
No, I think I'm pretty good. My hair's pretty thick, so I'm lucky.
Yeah. Any changes in the size or the color of your moles?
Nah,
No?
just many of them.
Okay. Do you have any problems with headaches?
Nah.
Dizziness? Feeling faint? Okay. Do you wear glasses or contacts?
I've worn contacts since probably the 4th grade.
Okay. Do you know when your last eye exam was?
Yeah, probably 2 years ago.
Okay. Might be a good idea to, just get those checked up on.
I know.
Any blurred vision, double vision?
No.
No. Excessive tearing or redness, itching?
Mm-mm.
No. Have you noticed any changes with your hearing, loss, or
No, I
ringing
think
in your ears?
just the guy's selective hearing.
No, yeah. Any problems with feeling off balance?
No.
Any earaches, frequent earaches,
Mm-mm.
discharge from your ears?
Absolutely not.
Do you get frequent colds?
No, I used to get obviously before I had my tonsils out, I had strep throat several times a year, but since I had my tonsillectomy, it's been actually pretty good.
Yeah. Any problems with your sinuses?
No.
Runny noses a lot?
No, once the weather breaks, fall and springtime, I get that normal sinus drainage, but other than that, pretty good.
Any nosebleeds?
No.
No?
Only one in my life.
Good, good. And how about your mouth, your teeth? Any bleeding in your gums?
No bleeding, but my teeth are terrible.
Oh, I'm sorry. When was your last dental exam?
The last time I had a root canal, which was several years ago.
Oh, you probably should.
I should.
Get that followed up on.
I'm not a big fan of the dentist.
No, I don't think any of us are, but gotta take care of those teeth. They're the
Yeah.
only ones you have. Do you have problems with dry mouth, frequent sore throats? No. How about in your neck? Do you notice any lumps or swollen glands? Any stiffness?
No.
No? Good. Cough?
No.
No sputum or anything?
No.
Difficulty breathing or wheezing related to activity? Okay. Heart murmur? Do you know if you have one?
No.
No?
Takes very fine.
Do you ever feel like your heart is racing?
No. Just...
No chest pain or discomfort there?
No.
Any difficulty swallowing?
Mm-hmm.
Heartburn, indigestion?
No, I'm actually pretty heartburn-free considering all the spicy foods I eat.
Oh, good. That's good. Nausea, vomiting?
No.
Any bowel irregularities?
No, I'm pretty regular.
Good. Changes in your appetite?
No.
How about abdominal pain, excessive bloating or gassiness?
No.
Noticing yellowing of the skin or eyes at all? Good. Your legs, notice any pain or swelling? Areas with redness that are tender?
No.
How about your hands or feet? You notice that they turn a color or they tingle when it's cold out?
No.
Good.
Not anything that would be abnormal.
Okay. Any recent changes in the frequency of your urination? Getting up in the middle of the night to use the bathroom?
No, I mean once a night, but I feel like that's pretty regular.
Okay, that's kind of like your usual.
Yeah,
now.
usual.
Okay. Pain in your back, your flank area?
No.
Good. You say that you're in a current relationship with your wife.
I am married.
Okay. How many sexual partners have you had in the last year?
Just her.
Okay.
Hopefully that's the same for her.
Let's hope so. Do you have any concerns about sexually transmitted diseases or infections?
No.
Okay, good. Are you performing monthly self-testicular exams?
Probably not monthly, but I do check.
Okay, it's best to probably do those in the shower,
Right.
You could probably try to do it at the same time every month.
I did have, in 2008, I did have a problem per se down there, I guess, but I was checked for pain down there. I was diagnosed with epididymitis.
Okay. But it's
I mean,
self-resolving?
Yeah, I mean, after that, it's never been an issue. I had some antibiotics, and it's actually never resurfaced.
Good, good. Have you had any problems with muscle or joint pain?
No.
Swelling, stiffness?
No.
Limited range of motion or activity? Any history of traumatic injury?
No. None.
And no history of back pain or joint pain associated with a fever or chill?
Absolutely not.
Good. Okay, have you ever had any problems with mood changes or attention span?
No, I'm pretty happy.
Okay, speech changes?
No.
No. Recent short or long-term memory loss?
No.
Problems with fainting, weakness, paralysis, numbness in your extremities? No.
Not to my knowledge.
Tremors or involuntary movements?
No.
Seizure history at all?
None whatsoever.
Okay. Do you bruise easily?
I do not.
Do you notice that it takes you a long time to stop bleeding if you cut yourself?
Mm-mm.
Good. And you ever notice that you've become extremely bothered by like heat or the cold? Get really agitated by it?
No.
Do you notice any excessive sweating, thirst, or hunger?
My wife complains when I sleep that I excessively sweat. But other than that, no.
Some of us are just sweat excited. Okay, we're going to start with the physical exam now.
Okay.
As you're sitting here, I'm noticing that you're not in any kind of distress. You appear to be alert and oriented. Your face is symmetric. You're making appropriate facial expressions, and you appear to be well groomed. I'm going to take your vital signs, your heart rate, your blood pressure, respiratory rate, your height and your weight, calculate your BMI, and possibly check your oxygen saturations if it's indicated, and assuming right now that they're all within normal limits. I'm going to assess your skin, assess the color, the temperature. It's nice and warm, pink. Your skin turgor is nice and not too tight. It's not tenting. You don't appear to have any kind of clubbing or cyanosis of your fingers here. I'm going to assess your head.
Okay.
Seems to be a good distribution of hair pattern. There's no lumps or lesions. I'm going to go ahead and assess your temporomandibular joint here. Can you just tell me if you feel any tenderness?
No.
Can you open your mouth? Close your mouth. All right. Good range of motion. No swelling. Can you go ahead and clench your teeth? Smile. Pop out your cheeks. Wrinkle your forehead. And then raise your eyebrows for me. Can you close your eyes? Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
All right. Can you feel this?
Okay.
How about this?
Mm-hmm.
Okay, your cranial nerve 5 and 7 is intact. Now we're going to move on to your ears. I'm going to get this ready. Just going to move the auricles here. Does this hurt at all?
It's not.
Press on your tragus. Does that hurt?
Mm-mm.
Okay. We're just going to go ahead and look inside your ear. Okay. There's a small amount of yellow cerumen in your ear. That's normal. Tympanic membrane appears to be a translucent pearly gray color. I don't see any redness, drainage, or exudates. We're going to move on to your, and I would go ahead and look in both ears for signs of infection, and just to make sure that I see the same thing. I'm just going to whisper something in your ear. Can you go ahead and repeat whatever you hear back to me?
Sure. Basketball.
Okay, and I would also do that on both sides. I'm going to go ahead and palpate your nose here. Any tenderness that you feel?
No.
Okay. And I'm going to palpate your maxillary sinuses. Any pain?
Mm-mm.
How about your frontal sinuses?
No.
Okay. I'm just going to go ahead and look inside of your nose. Can you just turn towards me, please?
Sure.
Alrighty. I'm going to just look up here. The turbinates appear pink and moist. I don't see any drainage or redness. No swelling. Your septum is midline. No deviation there. That's good. You can go ahead and turn back around. I'm just going to ask that you open your mouth
Excuse
for
me.
me.
Take a little.
Sorry. Usually I would use a tongue blade to depress his tongue, but I'm just going to take a look back here. Alright, I see you're awing for me already. That's good. Your soft palate rises. Your frenulum is midline. So your cranial nerve 10 is intact. Can you lift? Alright, and Wharton's ducts are visualized. Cranial nerve 12 is intact. I don't see any tonsillar enlargement, no leukoplakia, exudates, no redness, no signs of infection. And your hard and soft palates were both intact. We're going to go ahead and just feel your neck here for any kind of lumps or lesions. Does anything hurt that I'm pressing on?
No.
No? Good. Your trachea appears midline, no deviation to one side. I'm going to use the bell of my stethoscope to listen for a bruit in your carotid pulse. First I'm going to palpate on both sides. All right, now I'm just going to listen. get it on the right side. Okay, that sounds great. Now we're going to assess your lymph nodes.
Okay.
Okay, just let me know if any of these feel tender to you. There's your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, your supraclavicular, your superficial anterior cervical, and your deep cervical chain.
No.
No? Alright, great. Now we're going to assess your thyroid gland. Going to just locate your cricoid cartilage here and palpate your isthmus. Can you go ahead and swallow for me? Okay, nice and smooth. I don't feel any nodules there. That's good. Now we're going to just examine your eye.
Okay.
First, I'm just examining how they both look. They both appear symmetric. There's no ptosis or drooping. No drainage. I'm going to just tug down on both of your lower lids here and examine your conjunctiva and your sclera. Sclera, white, conjunctiva appear pink, no yellowing, no drainage. Your lacrimal apparatus looks good, no drainage there. I'm going to go ahead and just assess that your cranial nerve 2 is intact by wiggling my hands on either side of your head to test your peripheral vision. Just let me know when you see my fingers.
I see them.
Okay, and on this side?
See it.
Alright, great. I'm going to just test your field of vision now to assess your cranial nerve 3, 4, and 6.
Okay.
Can you just follow my finger without moving your head? Okay, I'm just going to move it towards your nose. Great. No nystagmus, and both of your eyes accommodate, which is normal. I'm going to just dim the lights really quick and check that you have nice and equal reactive pupils. And then I'm going to assess for your optic nerve and your red reflex. Okay, I'm just going to move in at a 15-degree angle here. Find your red reflex. Okay, and I'm going to follow a nerve back to your optic disc. Optic disc looks good, no opicities. Looks like a nice yellow-orange color, and I'm going to do that on both sides. Now if you can just look at my nose, I'm going to just assess that your pupils are nice and reactive. Good. Good, and as I'm watching the one react, I'm checking in the other eye to make sure that the reaction is consensual, and they were. Alrighty. We're going to move on to your chest and lungs. I'm just going to assess for pain or tenderness here. Do you feel any?
I do not.
Alright, great. I'm going to just check for some tactile firminitis. Can you say 99 for me?
99.
And again?
99.
And again?
99.
Great. Okay. I'm going to just check for bilateral expansion. I'm going to press my thumbs into your tense intercostal space back here. Can you take a deep breath? Great, and let it out. Good expansion bilaterally, nice and equal. Now I'm just going to percuss the front and the back of your chest. We're going to do the front first. Can you just lean back for me, please?
Sure.
Okay, we're going to do the back. Same thing. Okay, everything sounds good. Normal, no tympanic or dullness. We're going to go ahead and listen now. First the front. Nice deep breath for me. Okay, Again. Okay, and I'm just going to listen on your back. Okay, great. I don't hear any wheezes, crackles, or dry. Everything sounds equal on both sides, so that's good. I'm going to just move on to your cardiac exam here.
Okay.
First, I'm going to just feel all of your pulses here, make sure they're nice and equal. Your radial pulses, brachial pulses. I already felt your carotid pulses. Can I just have you swing your feet around here?
Sure.
Can you just lift one of your legs up for me here? Your dorsalis pedis, your posterior tibial, and then assuming that you would have a gown on, I would check your popliteal and possibly femoral, and I would do both sides there. Everything feels nice and equal. I'm just going to go ahead and listen to your heart, and if indicated, I would check for jugular venous distension. I would have you sit on the exam table and elevate the head of the bed 30 degrees, and then I would identify the highest point of pulsation and use a horizontal line to measure the sternal angle, and it shouldn't be any more than 4 centimeters in a normal adult. Okay. Just gonna go ahead and listen to your heart sounds here. So we're gonna listen to our aortic, and our pulmonic, our Erb's point, our tricuspid, and our mitral. Okay, no murmurs, and you've got a nice crisp S1, S2. I don't hear any rubs or gallops, and it sounds like you have a nice regular rate and rhythm. Capillary refill, forgot to mention, looks nice and brisk in all of your extremities. No clubbing or cyanosis. Okay. Now I'm going to ask you to just go ahead and get up on the exam table and lie flat for me. Just move this chair.
You want my head down in this direction?
Can you actually just scoot closer to me?
Sure.
Okay, I'm just going to lift your gown up here. Just going to examine the abdomen first. It looks nice and flat. There's no varicosities, no masses. Now I'm going to just auscultate in all 4 quadrants for bowel sounds, starting in the right lower quadrant. Okay, good. Bowel sounds on all quadrants. If I didn't hear, or if I was suspicious that maybe we would have a bowel obstruction or something of that nature and decreased bowel sounds, I would listen for a full minute in each quadrant before moving on. I'm going to go ahead and just percuss. Okay, everything sounds good. There's no dullness. Everything just sounds nice and tympanic. I'm going to go ahead and palpate now. light palpation and deep palpation. Okay, I'm just going to listen. I don't feel any masses. I'm going to listen for some bruits, aortic, renal, and iliac. Okay, now we're going to go ahead and assess for your liver span. I'm just going to percuss downward in your right midclavicular line here until I find the upper border of your liver. Okay, found the top edge of the liver. It sounds dull. Now I'm going to move upward from the abdomen in the same line. Okay, and here it is. And I would measure that to make sure that it's between 6 and 12 centimeters, which is normal. Going to assess for splenic dullness by percussing the lowest costal intercostal space and the left anterior axillary line. It should sound tympanic. Okay, that sounds good. Palpate your liver here. Okay, and it's about 1 to 2 centimeters below the right midclavicular line. I'm going to palpate for a spleen. The spleen should not be palpable. If I do palpate a spleen, it's going to indicate some enlargement. No spleen is palpable. And I forgot to mention that your liver feels nice and smooth, so that's normal. Non-tender, I'm assuming?
No.
Okay, good. Then can you go ahead and sit up for me? Okay, and I'm going to just palpate for costovertebral angle tenderness. And if you have any, this might hurt a little bit, okay?
Okay.
So just tell me if this hurts.
No.
Okay.
Nope.
All right, great. We're going to just check some range of motion now so you can stay there.
Okay.
Can you go ahead and shrug your shoulders? Okay, great. Do it against my hands. Good. Your cranial nerve 9 and 11 are intact. Can you move your head forward and backwards? Side to side. Good. No tenderness, stiffness?
Mm-mm.
Okay, great. Your upper arms, shoulders look symmetric. There's no deformity, no masses, and I'm assuming no tenderness.
No.
Can you make a fist with each hand? Okay, and open them. Can you squeeze my fingers? Okay, can you make your hands like this and like this? Turn your hands in. Turn your hands out. Good. Can you put your hands like this? Don't let me push them up. Okay, flip them over. Don't let me push them down. Great. Can you close your eyes, and I'm going to give you a sharp and a dull object, and I just want you to tell me what it is. Can you open your hand?
It was like a pen or pencil.
Okay. And a soft object?
Cotton ball.
All right, great. Thank you. Okay, I'm just going to assess your axillary and your epitrochlear nodes. Okay, no swelling or tenderness is noted there. All right, can I have you stand up? I'm just going to take a look at your back. Can you just bend forward and touch your toes? Any pain?
No.
Okay, can you bend back down? I'm just going to assess your spine here. Feels nice in midline. No signs of scoliosis or kyphosis. I'm just going to palpate your paravertebral muscles here for tenderness or spasms. Do you feel anything?
No.
Okay, great. And now I want you to stand up straight. Can you lean to your side? Any tenderness?
Nope.
Other side? Great, and I'm just going to support your back. Can you lean backwards? All right, that's good. No tenderness?
Nope.
Great. Can I have you sit back down?
Sure.
Okay. And I'm just going to pull your pant legs up.
Let me help you out.
Okay, I'm looking here at your leg. I don't see any kind of areas of redness, no swelling, edema, no varicose veins. I'm going to just take off your sock here and take a look at your toes. Okay. pulses feel good again, no swelling. Gonna just move here to check some range of motion. Any tenderness? No, it doesn't. I don't feel any swelling. Nice range of motion. Can you point your toes up? Point them down towards the floor. Can you move your toes in? Move your toes out. Can you press against my foot? Okay, and lift back. All right, great. Good range of motion there. Can I go ahead and have you pull your knee to your chest? Okay, and extend. All right, can I have you pull your knee up and move it in towards your midline? Okay, and just move it out towards your, okay, good range of motion in the hips. No pain or tenderness there. Great. Can you move your heel down your shin like this? Great, and the other side? And I would check all of those range of motion, and I would check the other leg just to make sure everything is symmetrical on both sides. Can I go ahead and have you stand up and walk heel to toe? Okay, and now turn around and just walk back on your toes. And now your heels. All right. Great. Can I just have you sit back down? We're going to just check some deep tendon reflexes.
Do my leg back.
Okay, we're just going to start up here. I'm going to use this as my reflex hammer. We're going to do your tricep. We're going to assume that this would, I feel the reflex. And I just want you to rest palm up here. Do your bicep. Your brachial, radial. We're going to do your knee. And then your ankle behind your Achilles tendon. And I would assess, even though I'm not seeing a reflex, I feel the actual reflex, and I didn't see any clonus in his extremities. And because you're a male, I would go probably do some prostate screening, do a digital exam, which we're not going to perform on camera, possibly send a specimen for a hemocult, and then maybe a PSA lab. They should be done about every 1 to 2 years.
Okay.
And then just go over with you again that you should be doing your monthly testicular exams and your breast exams. Do you have any questions about anything we went over today?
No.
All right. Well, it was great to meet you.
Nice to meet you. Thank you for your time.
Of course. Thank you.